Hello and welcome back. I'm Nurse Alyssa, and today we're going to talk about Extrasorb Absorbent Under Pad. But first, if you could hit that like and subscribe, it would be greatly appreciated as it does help my channel. So let's get started. So Extrasorb Under Pad is a disposable underpad designed with a breathable top sheet. So then any exposed skin that is touching that sheet, it is not getting wet from any urine or whatever moisture is getting on that. There is also an odor management middle. It is super absorbent. In the presence of moisture, the top sheet is designed to keep that skin completely dry. It can hold up to 1,000 mils of moisture, which is a very high amount of moisture for a disposable absorbent pad. That's a lot of fluid it can hold and keep a person still dry. When wet, the underpad is air can get through it, but it's not going to let any moisture out until the saturation point. Then the air can't flow through it anymore. It does need to be changed when it is saturated. And it may also be used on supportive surfaces. So if somebody's sitting in a chair, on a roho, or laying down on an air mattress, it can be used without causing any issues. Those surfaces will work properly still. We're going to use these pads for anyone who either can't wear or isn't wearing a brief or something to contain urinary or fecal incontinence. So it's just another thing that we can use, kind of put in our back pocket as knowledge, something that we can use, especially even if patients say they have colorectal cancer and they can't wear a brief because it causes them pain. There could be many issues for this, but this is a great option because it holds so much moisture. It can also be used if we're trying to toilet train. Say somebody had a catheter and they have a little bit of incontinence. Trying to toilet train, this is a good option. And also if somebody has been wearing a brief and they now have a rash from it, this can give their the area time to breathe, have access to air, clear up, just gives it a little break. So just a precaution, there is writing on one side of the pad and the other side does not have writing on it, which is white. You want to make sure that the white side is up and the printed side is underneath, so it's absorbing properly. If it's the other way around, the fluid's going to go everywhere. So just some contraindications. We are not going to fold the pads at all because they do need to lie flat for the fluid to gel. We're also not going to use them for any procedures. So we have those blue pads for that. The cost price is obviously going to be cheaper just for a disposable procedure blue pad just to collect very little amounts of water when we're irrigating. So don't use it for that. Don't use multi-layers. One single layer is all you need. Change that as needed. And don't use this as a lifter sheet. We could put this on top of a lifter sheet, but we're still using the lifter sheet to move them, not this. So how we're going to apply this, so we're going to make sure that the mattress sheet doesn't have any wrinkles, and you're just going to lay everything nice and flat. Any wrinkles can also be a cause of pressure point injuries, so we want to make sure that when somebody is laying down all the time or sitting down all the time, everything needs to be flat. We don't want to cause other pressure point injuries, causing wounds. We don't want that. We want to deal with just one least amount of things as possible. So we're going to change this. It's not set time. It's when it gets soiled. So it does swell up. The course swells. So you'll be able to notice it visually and to touch it. And you're not going to wash this. It's just completely disposable. They are not to be washed. They will make a mess out of your washing machine if you were to do that. And the expected outcome is that it's protecting the patient and the bed. They don't have any tissue breakdown from the moisture. And if they had any brushes, that they are cleared up. So thank you for watching. That's all I have for this video, and I will catch you in my next one.